I am Dr. Parameshwara C M, Chief Colorectal Surgeon and CEO of Smiles Institute of Gastroenterology. There are two common fears when people are diagnosed to have a fistula. The two common fears are, one is the recurrence, the second is incontinence, losing control over the stools. Yes, many people, when they have landed in the hands of a quack, when they have landed in the hands of an incompetent surgeon, they have lost control over the stools, and whole life some people have lost control. Actually, in the hands of a competent surgeons, this can be 100% prevented. They simply cannot lose control over the stools for a simple fistula surgery. It is really a crime if patient lose control over stools. So my message to patients who have the fear of losing control of stools is, never have that fear. If you land up in the hands of a safe surgeon, competent surgeons, you will never lose control over stools. Just forget it. Number two is recurrence rates. Yes, fistula recurrence rates are very, very common. The literature says the fistula recurrence rates are as high as 15% in the world. In India, we have largest volumes of fistula cases. Indian surgeons are best across the globe. We at Smiles, we are pioneers in fistula, and we are a research institute for fistula. In the last 9 years, our recurrence rates are as less as 4%. So we have the best procedures combined. We have combined our procedures with Ayurveda. So there is an integration of Ayurveda and allopathy. We are the first people to practice integrated approach towards a fistula. The most important thing in a fistula to prevent recurrence is the scan. The scan, the radiologist role is very, very important in a fistula, wherein he gives a proper scan so that we as surgeons use that scan and operate with our best clinical acumen what we have and get good clinical outcomes and prevent recurrence. So in our center, the recurrence rates are as less as 4%.